My name is Kate Fisch. I'm the Associate Vice President of Clinical Services for the Odyssey Eating Disorder Network. ARFID stands for Avoidant and Restrictive Food Intake Disorder. ARFID's much easier to say. ARFID is a biologically based psychiatric illness that is characterized by a restriction of food intake that results in weight loss to the point of severe malnutrition, and in children results in them not meeting milestones that are developmentally appropriate. ARFID, when you hear food restriction, we often think of anorexia nervosa, but it is different. Individuals, and it's usually children, although it can affect adults, children and adults that are diagnosed with ARFID are different in that they don't have this debilitating fear of weight gain or of being fat as individuals with anorexia do. And individuals with ARFID also don't base their own self-evaluation on how they look or their body shape and size. Now, there are 3 different types of ARFID, although it's more on a continuum rather than these being mutually exclusive of each other. So some people avoid food intake because of sensory issues. So they don't like the way that the food feels in their mouth, the texture. Sometimes it might be cold foods or hot foods, for example. So it's not surprising that 20% of people who are diagnosed with ARFID also have a diagnosis of autism spectrum disorder, since both have some aversion to sensory issues. So because ARFID is different than anorexia, we don't spend as much time in treatment with our clients, with our ARFID clients, focusing on negative body image or focusing on dispelling the myth about how we want to look or how society thinks we should look. Instead, we focus on exposing them to new foods and helping them to feel more desensitized to those foods so that when exposed, their reaction isn't so distressing. We also work to teach them how to develop skills to better calm themselves down when they are distressed, rather than just deciding to avoid the thing that's distressing altogether, which is food in this case.